is diagnosed with type 2 diabetes, what future health consequences can result from that? Are they permanent? Can they cure it? What sorts of things do you see?
Okay, so your first question is what do they experience right when they're diagnosed, when they're young? Okay, the biggest problem with type 2 diabetes or anything like that when kids are young is it disrupts their normal development as a child. This is an 8-9-year-old kid now with like a major chronic disease that can really impact their daily functioning, everything they do. Eat, exercise, play, be like other kids. Some kids with early type 2 diabetes can just be on oral medications, but a lot of kids with type 2 diabetes in youth have to be on insulin. So they have to check their blood sugar, they have to take insulin, they have to worry about being low. They have to be just very grown up because they're dealing with a chronic disease. Type 2, before a child with type 2 diabetes gets diabetes, they've already experienced complications of obesity, most likely. Obesity alone can impair a lot of things, psychobehavioral issues, social issues, sleep apnea is very common, things like that. So down the road, of course, we would presume that kids with type 2 diabetes would experience complications earlier. I don't think we have a ton of data yet, though, to say that a child who's 8 versus a child who's 12, what are the factors for complications? Are they going to happen in the 20s and 30s? I think there's research now that's ongoing that's going to help answer that question. A lot of the type 2 information I give you that you hear about and that people know derives from adult studies. So, for example, one of the studies called the Today study, which is the largest clinical trial for type 2 diabetes in kids, just got sort of wrapped up and is in the process of being analyzed. So we'll have a lot more data, and then that group is going to need to be followed closely to sort of say, what happens to these people when they're 20 or 30 or 40,
And it's going to be interesting to see what happens. I know in clinical practice, I don't deal with kids, I deal with adults, but some of the things they suffer from as a result of having type 2 diabetes and being obese is very tragic, and it's sad to see that.
Yeah, and we unfortunately, at this point, the only thing we can presume is that they'll experience complications earlier.